Tier 1 Orthopedic and Neurosurgical Institute, here we offer all manner of fracture care, all manner of joint replacement surgery, and also interventions in the spine, lower lumbar, as well as some of the family care or primary care aspects of sports medicine as well. I specialize in all manner of orthopedic care, joint replacement surgeries involving the shoulder, hips, and knees, all manner of fracture care, and some pediatric care as well. I originally trained as a mechanical engineer at Purdue University. After working professionally for about 3 years, I went back to medical school, trained in Northeast Missouri, and did my residency up in Chicago, training at over 9 different hospital systems throughout the city. I really gravitated towards orthopedics because it makes sense. Things have a reason. If things are broken, you fix them. If you can't fix them, typically replace them. If you can't replace them, you sometimes take them out. But it's a very systematic way, very similar to engineering. I've been trained in all manner of minimally invasive surgery, not only with minimally invasive approaches to the hip, as well as the knee, and also some recent shoulder replacement surgeries that were not available more than 5 or 10 years ago. Some of the more recent advancements in shoulder surgery involve basically the use of what's called a reverse shoulder arthroplasty, where actually we can bypass the usage of the rotator cuff and instability that would typically not be able to be treated surgically. The fact that we've optimized the procedures that we're doing for joint replacements and fracture care, and the patients are not having a significant amount of perioperative pain, that's why they're typically able to leave same day. Here at Tier 1, we've also recruited a number of individuals who have expanded our subspecialties to include the care of basically the non-surgical aspects of musculoskeletal care, lower lumbar pain, and also the interventions associated with that. The fact that we have physical therapy and an MRI associated with our practice directly here is also a huge advantage for us to be able to get the care the patients need in a more urgent manner. We can see patients same day if they have some issues. One of the reasons I chose to get into medicine was actually I had an injury myself. At that time I was working professionally and managed to cut my hand pretty badly and required surgery. When I saw the systematic way in which he saw my pathology and was able to help me, I was tremendously grateful. And I started looking into what it ultimately involved, and I felt like it fit my personality quite well. I saw it as a way of being able to really help people. I'm originally from a very rural town in western Ohio. Basically grew up in a very small town, graduating class of about 80. And so this is borderline big city living for me. The thing that really brought me to Cookeville is the community setting, the practice itself being very collegial, working with the hospital very closely, having a good, well-organized orthopedic practice, but also the ancillary things like the community amenities that are available, the outdoors, and I prefer the more rural setting. As outside hobbies, I'm basically looking for things to fix, things to work on. I enjoy working on my cars, trucks, I like woodworking, metalworking, with the ultimate goal of building my own airplane at some point. One of the things that I truly enjoy about orthopedics is seeing patients who need help and that we can give them a higher level of function, get them back to doing what they want to do, and that really seems fulfilling to me.